Today we're going to be doing a bed bath. Mr. Smith, can you tell me your name and date of birth? Okay, all right. Well, we're going to give you a bath today. The reason we would be doing this is to obviously to cleanse the skin. We're going to reduce the amount of bacteria on the skin. It can be for relaxation purposes for the patient. It will stimulate some circulation, and just think we all feel better after we've had a bath. So we're gonna do that. All right, we've identified the patient. We're going to pull the curtain, which I'm not going to do because I want you to be able to see me on the video, but we would pull the curtain for some privacy or close the door. We're going to go ahead and raise this patient up. We're going to work smarter, not harder. And not too far because I'm short. All right, so we've identified the patient. I'm going to go ahead and ask, do you need to use the restroom? If they do, you want them to go ahead and use the urinal or the bedpan, or get them up to use the bathroom if they can get up, so that we can go ahead and clean them completely after that. I am going to perform hand hygiene. Get that done. I'm going to get myself some gloves. I'm going to need a towel and a bath blanket. So I'm going to go ahead and have these here with me. Alright, so this shouldn't be painful or anything like that. If there is any pain, definitely let me know. This should just be comfortable. Alright, so the first thing I'm going to do, get my washcloth wet. Alright, I'm going to clean your eyes to begin with. I'm going to start here in the corner of your eye and go out. Use a different part of the cloth to go from the inner cannula out. Once we've done that, I'm going to go ahead and just wash his face. Is that comfortable? Is that warm enough for you? Okay. All right. Pause. Pause.
Go.
Okay, so I'm just going to go ahead and get this gown off of you. We'll get you another one here shortly. Okay. Get your arm out. All right. I'm going to keep you covered up. I don't want you getting cold. All right. This and the dirty laundry. All right. Okay, so now I'm going to get a bath blanket to cover you up with. Sheets all wet. Alright, the next thing I'm going to do is work on your arm. So I'm going to uncover this arm. I'm going to put a towel under here just to make sure you don't get you wet. Okay. Alright, we're going to start with the first one and start with your hands. Okay. Just feels good to get your hands washed. Get down between each of these. Okay. Alright, so I started with the hand, and I'm going to work my way up the arm with this, which I'm not doing a very good job of. Here we go. Work my way up the arm because we want to push that circulation back toward the heart. I'll get you to lift your arm if you can. Get under this axilla. Alright, relax that down. I have somebody else who is helping me, but also what we could do is use the same cloth, and we would start at the bottom of the hand and go all the way up to the axilla on the other arm. Okay. So then the arms are done, and we will out. Alright, next we are going to work on the chest. Good. So, not pull your skin there. Okay. Alright, next. Alright, so I'm just gonna start at the top. It does smell good. You good? I'm gonna bring this towel up here because I know that's cold. It's cold in this room. Alright. Just going down almost to the groin. Alright. So, now that we've done that, I'm going to put some deodorant on because that's going to be an important thing to do. We've got some roll-on here. I'll get you to raise that arm. Let's get you good. Deodorize so you'll feel good and smell good. Alright, do that. Also going to make sure, especially if it's a female, that I dry really well under the breast tissue. Alright, and now I'm going to get a clean gown to put on you. Keep you warm. Alright. Let's see. These are one size fits nobody, so here we go. Come back and snap that in just a minute. Get rid of this towel. Okay. Alright. Now we'll go ahead and work on this leg. Don't worry about snapping in a minute because I know we got a lot of other things to do here. Now we'll get these legs clean. So we're going to start at the ankle and go all the way almost to the groin. Okay, so we will just kind of, I'm gonna do the calf. On that knee really well. Here, not going too much up in there. Backside a little better when we get there. Alright, and I'm going to go ahead and get this foot. I'm going to get down between those toes. And while you're doing all this bathing, that's a good time to be looking in between those toes. Make sure you don't have any skin breakdown. Our patient has diabetes, so I'm especially worried about the bottom of those feet. I want to make sure that there's no sores starting. And then I'm going to throw this washcloth out. You can use as many of those washcloths as you need to. Typically we would say you would use one for this, but let's say their feet were really, really dirty. It might take several. Alright, and so we would do the other leg the same as this one. We'd go from here to here, clean all of that, then clean the feet, the other foot, clean between the toes, the bottom of the foot, checking for any kind of sores or any kind of skin breakdown. Alright, so we've got that. Okay, So we've got all of that done. One thing that we want to point out is that Mr. Jones has got this IV over here. When we are cleaning around the IV, we would take our cloth and we would clean up to the site and around the site. We are not going to clean the IV itself. We're not going to clean any of that line. We're not going to clean the Tegaderm or any of the protective tape that's on that. Just go completely around that. Now later on in a later class, you're going to learn all about taking care of that IV site. But for this semester, we just don't want to do anything to that other than look at it, make sure it's not bleeding or pulled out. Okay? All right. Now there's, on the sheet, you can either go ahead and put him up on his side and do his back and his buttocks, and then roll him back over and do the groin and the genital area. However, when we get finished, I think I'm going to keep him propped up on his side, get him up off of that sacral area. So I'm going to go ahead and do the genital area now, and then we'll roll him over. Okay? So what I'm going to do, I'm going to get this.